Multiple sclerosis, MS, is a chronic and potentially disabling neurological condition that affects the central nervous system, CNS, which includes the brain and spinal cord. It is an autoimmune disease, meaning that the immune system mistakenly attacks the myelin sheath, a protective covering that surrounds nerve fibers in the CNS. The immune system's attack on the myelin sheath disrupts the normal flow of electrical impulses along the nerves. This can lead to various symptoms that vary widely from person to person. Common symptoms of multiple sclerosis include fatigue, difficulty walking, muscle weakness, numbness or tingling, problems with coordination and balance, vision problems, bladder and bowel dysfunction, cognitive impairment, and emotional changes. MS is typically diagnosed based on a combination of medical history, neurological examination, and various tests, such as magnetic resonance imaging, MRI, to detect the presence of lesions or areas of inflammation in the CNS. There is no specific test for MS, and the diagnosis often involves ruling out other possible causes of the symptoms. The symptoms of multiple sclerosis, MS, can vary widely from person to person, and they depend on the location and extent of damage to the central nervous system, CNS. Here are some common symptoms that individuals with MS may experience. Fatigue. Fatigue is a common symptom of MS and can be debilitating, leading to a feeling of exhaustion even after minimal physical or mental exertion. Motor symptoms. These can include muscle weakness, difficulty with coordination and balance, tremors, spasticity, stiffness and involuntary muscle contractions, and problems with walking or gait. Sensory symptoms. MS can cause various sensory disturbances, such as numbness, tingling, or a pins and needles sensation in different parts of the body. Some individuals may experience pain or hypersensitivity to touch. Visual changes. MS can affect vision, leading to blurred vision, double vision, diplopia, or partial or complete loss of vision in one eye. Eye pain and involuntary eye movements may also occur. Cognitive changes. MS can impact cognitive function, resulting in problems with memory, attention, concentration, and information processing. Some individuals may experience difficulty with problem solving, multitasking, and verbal fluency. Emotional changes, mood swings, depression, anxiety, and irritability are common in people with MS. These emotional changes can be related to the challenges of living with a chronic condition or may be a result of the disease process itself. Bladder and bowel dysfunction. MS can affect the control of the bladder and bowel, leading to urinary urgency, frequency, incontinence, or difficulty emptying the bladder. Constipation or loss of bowel control may also occur. Sexual dysfunction. MS can interfere with sexual function, leading to decreased libido, erectile dysfunction in men, and reduced vaginal lubrication and sensation in women. Speech and swallowing difficulties. Some individuals with MS may experience slurred speech, difficulty articulating words, or problems with swallowing. The exact cause of multiple sclerosis, MS, is not fully understood. It is believed to be a complex interplay of genetic and environmental factors that contribute to the development of the condition. Here are some key factors that are thought to play a role. Autoimmune dysfunction. MS is considered an autoimmune disease, which means that the immune system mistakenly attacks healthy tissues in the body. In the case of MS, the immune system targets the myelin sheath, a protective covering around nerve fibers in the central nervous system, CNS. This immune attack leads to inflammation, demyelination, loss of myelin, and damage to the underlying nerve fibers. Genetic factors. MS is not directly inherited, but certain genetic variations or variations in specific genes have been associated with an increased risk of developing the condition. Family history can be a risk factor, as individuals with a first-degree relative, such as a parent or sibling, with MS have a higher likelihood of developing the disease compared to the general population. Environmental factors. Various environmental factors are believed to contribute to the risk of developing MS. Some studies suggest that exposure to certain viruses, such as the Epstein-Barr virus, EBV, may increase the risk of developing MS, especially in individuals with a genetic predisposition. Other environmental factors that have been investigated include vitamin D deficiency, smoking, certain dietary factors, and exposure to toxins. Immunological factors. Dysregulation of the immune system is thought to be a key factor in the development of MS. Abnormal activation of immune cells, such as T cells and B cells, and their interaction with other immune cells and molecules contribute to the immune response against the myelin sheath. This immune response leads to inflammation and subsequent damage to the CNS. The treatment of multiple sclerosis, MS, aims to manage symptoms, slow down the progression of the disease, and improve the quality of life for individuals living with MS. The specific treatment approach depends on several factors, including the type and severity of MS, individual symptoms, and the individual's overall health. Here are some common treatment options. Disease-modifying therapies, DMTs. These medications are designed to modify the immune system's response and reduce the frequency and severity of relapses in individuals with relapsing remitting MS, RRMS, or active secondary progressive MS, SPMS. There are various DMTs available, including injectable medications, oral medications, and infusions. The choice of DMT depends on factors such as disease activity, potential side effects, and individual preferences. Symptomatic treatments. Symptomatic treatments focus on managing specific symptoms of MS. For example, medications may be prescribed to help manage muscle stiffness and spasms, spasticity, bladder and bowel dysfunction, pain, fatigue, and depression. Physical therapy, occupational therapy, and speech therapy can also be beneficial in managing symptoms and maintaining function. Rehabilitation therapies. Rehabilitation therapies, including physical therapy, occupational therapy, and speech therapy, can help individuals with MS improve their strength, coordination, balance, and mobility. These therapies aim to maximize independence and improve overall quality of life. Supportive therapies. Supportive therapies can help manage various aspects of MS. This may include psychological support, counseling, and support groups to address emotional and mental health challenges associated with living with a chronic condition. Assistive devices such as canes, walkers, and mobility aids can also be helpful in managing mobility difficulty. Lifestyle modifications. Certain lifestyle modifications may help individuals with MS manage their condition. This can include regular exercise, a healthy diet, stress management techniques, and adequate rest and sleep. Additionally, maintaining optimal levels of vitamin D, which may involve supplements, and avoiding smoking and excessive alcohol consumption are recommended.